This is how HIV is killing your people, even if you don't know. Enough is enough, please do something. Have you heard about the new infections of HIV that is killing people today? In a moment the needle of a watch is stepping, millions of people are buried. Dr. Tedros Adhanom Ghebreyesus, the WHO, World Health Organization, Director General said,
"Ending AIDS is everybody's business."
Ending AIDS, is everybody's business. So what are doing to save the world? Where is your contribution? HIV, AIDS. First identified in Democratic Republic of the Congo in 1976, HIV, AIDS has truly proven itself as a global pandemic, killing more than 36 million people since 1981. Currently there are between 31 and 35 million people living with HIV. The vast majority of those are in sub-Saharan Africa, where 5% of the population is infected, roughly 21 million people. As awareness has grown, new treatments have been developed that make HIV far more manageable, and many of those infected go on to lead productive lives. Between 2005 and 2012, the annual global deaths from HIV, AIDS dropped from 2.2 million to 1.6 million. Even today, the millions of people are dying every second due to HIV. Look at how World Health Organization is explaining.
HIV continues to affect millions of people worldwide. Progress against HIV has been uneven and unequal. Even before COVID, important groups and populations were underserved. Children, adolescents, and other populations at high HIV risk are among those who are not being sufficiently reached by HIV testing, prevention, treatment, and care services, resulting in 4,100 new HIV infections every day. Did you know that 70% of new HIV infections are among key populations: men who have sex with men, sex workers, transgender people, people who inject drugs, people in prisons, and their partners? Only 52% of children living with HIV are on life-saving treatment, compared to 76% of adults. We have only 8 years left to reach the 2030 goal of ending AIDS as a public health threat. That's why WHO is calling on global leaders and citizens to rally to confront the inequalities that drive AIDS, and to ensure everyone everywhere has access to HIV services. This means finding innovative ways to deliver person-centered HIV prevention, testing, treatment, and care services to everyone, irrespective of where they live or who people love. Doubling efforts to ensure all children living with HIV have access to testing and treatment, and all mothers have access to medicines to prevent or treat HIV before, during, and after pregnancy. Ensuring that all people at risk continue to obtain the services they need. Protecting, engaging, and supporting health workers to provide care that is kind, respectful of human rights, and without stigma or discrimination. To get this done in time, we need to renew and revitalize and accelerate the global fight to end AIDS by 2030. We have come so far, and we all must embrace the roles we have to play in equalizing the AIDS response.
As we said before, ending HIV is a business of everyone all over the world. Then, what are the symptoms of HIV? HIV infection happens in 3 stages. Without treatment, it gets worse over time and eventually overpowers your immune system. Your symptoms will depend on your stage. The only way you can know for sure if you have HIV is to get tested. Although the virus can cause symptoms, they're not a reliable way to tell if you're infected. In fact, some people won't have any symptoms at all. So even if you don't have any of the typical signs of an infection, you should always get tested if you think you are at risk. Some people notice flu-like symptoms 1 to 4 weeks after they are first infected. These often only last a week or 2. This first stage is called acute or primary HIV infection. Then, you may go for 10 years or more without further symptoms. This is called asymptomatic HIV infection. Even though you feel fine, the virus is still active in your body. And you can still give it to someone else. Once HIV has seriously harmed your immune system, you're at risk for diseases that a healthy body could fight off. In this stage, symptomatic HIV infection, you start to notice problems caused by these opportunistic infections. First stage, acute HIV infection symptoms. Most people don't know right away when they've been infected with HIV. But they may have symptoms within 2 to 4 weeks after they've gotten the virus. This is when your body's immune system puts up a fight. It's called acute retroviral syndrome or primary HIV infection. The symptoms are similar to those of other viral illnesses, and they're often compared to the flu. They typically last a week or 2 and then go away. Early signs of HIV include headache, fatigue, aching muscles, sore throat, swollen lymph nodes, a red rash that doesn't itch, usually on your torso, fever, ulcers, sores, in your mouth, esophagus, anus, or genitals. If you have symptoms like these and might have come into contact with someone with HIV in the past 2 to 6 weeks, go to a doctor and ask that you get an HIV test. If you don't have symptoms but still think you might have come into contact with the virus, get tested. Related. Early testing is important for 2 reasons. First, at this stage, levels of HIV in your blood and bodily fluids are very high. This makes it especially contagious. Second, starting treatment as soon as possible will help boost your immune system and ease your symptoms. A combination of medications, called HIV drugs, antiretroviral therapy, or ART, can help fight HIV, keep your immune system healthy, and keep you from spreading the virus. If you take these medications and have healthy habits, your HIV infection probably won't get worse. Second stage, clinical latency symptoms. After your immune system loses the battle with HIV, the flu-like symptoms will go away. But there's a lot going on inside your body. Doctors call this the asymptomatic period or chronic HIV infection. In your body, cells called CD4 T cells coordinate your immune system's response. During this stage, untreated HIV will kill CD4 cells and destroy your immune system. Your doctor can check how many of these cells you have with blood tests. Without treatment, the number of CD4 cells will drop, and you'll be more likely to get other infections. Most people don't have symptoms they can see or feel. You may not realize that you're infected and can pass HIV on to others. If you're taking ART, you might stay in this phase for decades. You can pass the virus on to other people, but it's extremely rare if you take your medicines. Third stage, AIDS symptoms. AIDS is the advanced stage of HIV infection. This is usually when your CD4 T cell number drops below 200 and your immune system is badly damaged. You might get an opportunistic infection, an illness that happens more often and is worse in people who have weakened immune systems. Some of these, such as Kaposi's sarcoma, a form of skin cancer, and pneumocystis pneumonia, a lung disease, are also considered AIDS-defining illnesses. If you didn't know earlier that you were infected with HIV, you may realize it after you have some of these symptoms. Being tired all the time. Swollen lymph nodes in your neck or groin. Fever that lasts more than 10 days. Night sweats. Weight loss with no obvious reason. Purplish spots on your skin that don't go away. Shortness of breath. Severe, long-lasting diarrhea. Yeast infections in your mouth, throat, or vagina. Bruises or bleeding you can't explain. Neurological symptoms such as memory loss, confusion, balance problems, behavior changes, seizures, and vision changes. People with AIDS who don't take medication live about 3 years, or less if they get another infection. But HIV can still be treated at this stage. If you start on HIV drugs, stay on them, follow your doctor's advice, and keep healthy habits, you can live a long time.